In this chapter, we will be discussing administrative considerations of application of therapeutic modalities. So this is Starkey, Chapter 4. Our objectives are to explain the concepts related to administration as it pertains to therapeutic modality deliverance. We will identify legal considerations pertinent to the delivery of treatments using therapeutic modalities. We will identify strategies for maintaining a safe facility, and then describe the role of medical records and also describe a few billing issues. Starting with legal considerations in patient care, during therapeutic interventions, your minimum legal duty is to prevent further injury or harm to the patient by performing the tasks in a professionally accepted manner. Professional ethics and responsibility mandate that the care be provided in the best interest of the patient, be safe and effective, and progress towards meeting the patient's goals. Before using a therapeutic modality, you must be familiar with the effects, side effects of the device or protocol being used, and be able to recognize contraindications that prohibit use. Proper use of modalities also requires knowledge of the device's characteristics, the maintenance requirements, and the safety considerations. So these are some important kind of large concepts related to legal considerations of modality application. Sometimes the athletic trainer, though, wonders, are we legally allowed to do ultrasound, e-stim, laser, even you could say some of the mechanical modalities such as massage or deep tissue work? Where in any law anywhere does it say that we're allowed to do that? And another way of thinking about that is, how do we know that we're legally allowed to do it? So let's talk then about scope of practice. So, because another way of answering the question that I just asked is, what is in our scope of practice? So the definition of scope of practice is legal boundaries that define the manner in which clinicians may practice. This is often established on a state-by-state basis because each state has a practice act that governs the regulation of athletic trainers. Well, let me back up from that. If the state has, say, a licensure law saying that athletic trainers have to be licensed, like Virginia does, then in that law, it may state what the legal boundaries are. So that's one way to figure out what modalities are in your scope of practice. And another way to figure that out is, what are the best practice statements put out by the NATA? So we can look at NATA position statements. And then another way to discuss what your scope of practice is in the Institutional Policies and Procedures Manual. So in the site that you're working, what is appropriate, what is required, what is not allowed. So at particular colleges, we may do things in a particular way. At a high school, we may do them differently. At a private school, we may do things differently than at a public school. So as I tell you guys all the time, it depends on what setting you're working in. So let's address, though, this issue of you guys are going to work likely. I mean, most of us are from Virginia, so we're maybe finding ourselves working in Virginia. So what does the Virginia law say about what modalities we're able to use and not able to use? Because, again, this will vary on a state-by-state basis. So I've downloaded the Virginia regulations governing the licensure of athletic trainers. Let me see if I can put this into a full page. I can, but it doesn't take away the menu that I wanted to take away. So hold on a second. Yeah, there we go. Okay, so these are the Virginia regulations. And as you can see on this side on page 2, yeah, I like that better. Good. Excuse me. In the table of contents, we have general provisions, requirements for licensure, aspects of renewal and reinstatement, standards of practice, fees, and then standards of professional conduct. So if we look at standards of practice, there's individual and general responsibilities. Those would probably be the two areas where we could find the most information about what we should and should not be doing as it pertains to all the practice of athletic training, but also as it pertains to modalities. So here's our requirements for licensure. This is not what we're trying to learn about. I'll make it bigger so you guys can see it easier. All right, there's aspects describing provisional licensure. There's renewal reinstatement. And here's our standards of practice. The athletic trainer's responsibilities are to evaluate the individual being treated, plan the treatment program, and administer and document the treatment within the limit of his professional knowledge, judgment, and skills, and in accordance with the practice of athletic training set forth in the Code of Virginia. So the general responsibilities. All right, the athletic trainer shall be responsible for the actions of persons engaging in the practice of athletic training who are under his supervision and direction. And the athletic trainer shall ensure that unlicensed persons shall not perform those functions. And then there's some supervisory responsibilities. And this is it. So let's go back to where we started. Standards of practice. Here's a one-sentence statement about what athletic trainers are allowed to do in the state of Virginia. So then if we go back to the question of what are you allowed to do, your practice is defined, what you're capable of doing in your practice is defined by then what you were taught. So by virtue of me teaching you in modalities class how to do laser and E-stim, by virtue of the fact that these are educational competencies set forth by the NATA, these are things that you're tested on by the BOC, so they are things that you are allowed to do. Okay, so that's how we answer that question of the legal issues and what is in your scope of practice. All right, so medical prescription. The idea of a patient being prescribed to do therapy with an athletic trainer or any other healthcare provider is going to vary state by state, and it's going to happen one of two ways. There's either going to be direct referral from a physician, or the care providers may have direct access without physician referral. This a lot of times is talking about this as far as being in the therapeutic intervention kind of range. We're many times talking about physical therapy and not athletic training. Therapeutic modalities that require prescription medications necessitate that each patient have a prescription. So this is another way that we would deal with medical prescriptions. We're going to discuss phonophoresis and iontophoresis, and those are two in which a prescription medication may be required in order to do the therapeutic modality application. And again, that needs to be prescribed to a patient, although sometimes you will see where the physician, so say like Dr. Deck may write a prescription for a Voltaren gel to be used with ultrasound, and that may be something that she allows the athletic trainers in the Longwood Athletic Training Room just to have on hand. And we'll discuss that more when we get to it. All right, so we have to pay attention to what our medical prescriptions are in some cases as well. All right, this is something that we don't talk about very often, which is informed consent. So informed consent means that the patient must grant their consent to be treated. If a patient comes into the athletic training room and asks you to treat them, then that implies their consent. Okay, and of course that first clause there says except in cases of emergency. So what you learned about in first aid is that you either have implied or expressed consent. So if your patient is unconscious or you're dealing with a minor like a child, you have implied consent to take care of them. If the patient is conscious, then they must give some sort of consent, either by a nod of a head or actually verbally or even in writing giving consent for care. But again, if the patient walks into your athletic training clinic in your high school or your college campus, they're coming to you to ask the question that implies consent. For negligence to be determined for lack of informed consent, the patient must suffer harm from the care rendered. So we're going to learn the components of negligence today as well. It's your job, too, to educate the patient before each treatment on what he or she should expect. So this is a really important part of informed consent. Keep in mind that your patient can say no at any time. A signed informed consent should be on file, and this is a lot of times done at the beginning of the year and is a blanket statement of you have my permission to provide care for me throughout this school year, sports season, whatever it is. If the patient is 18 years of age or younger, then the consent form must be signed by the parent or the legal guardian. So keep that in mind as well. The way that I handled this at the high school level is I would have an athletic training informed consent form, and the parents would sign in on one of two statements. So one statement would say, I hereby grant permission to the athletic trainer to take care of my son or daughter for any injuries or illnesses obtained while participating in sports at this school. And then the next statement was, I do not grant the athletic trainer permission to provide athletic training services to my son or daughter, but I understand that the athletic trainer will provide emergency care and first aid to my son or daughter if it becomes necessary. Because you want the parents to have the option to say, we don't believe in athletic training services and we don't want you to touch our kid. So that's an important aspect. I always felt like it was important to have that on file, not necessarily for legal reasons, but mostly just to communicate with the parents about what is it that you want. What skills do you want me to provide your child? Okay, so that's one way to handle that as well. All right, patient confidentiality. We want to make sure that we are adhering all the time to HIPAA requirements as well as FERPA. So FERPA protects educational records, while HIPAA prevents this stuff called protected health information. So that would be past, present, and future medical records that must be kept, again, confidential. So you guys have been trained in HIPAA previously, and we'll talk more about it when we have administration class next semester. But we do know that we need to maintain at all times our patient confidentiality. All right, so next let's talk about negligence. The thing that we kind of worry about all the time as healthcare providers, and all healthcare providers worry about this, is being sued by the patient for doing something wrong, which would be doing the wrong thing, period, or doing the right thing but doing it incorrectly. So negligence is the concept of providing care that falls below the minimally accepted standard, which is sometimes called not upholding the standard of care. This is determined by many factors, including standards of practice, policies and procedures manual, best practice, and state practice acts. So if someone was trying to sue an athletic trainer for negligence in the state of Virginia, then the language under the state law is vague enough that they probably wouldn't be able to get very far with that. I don't think there's not anything specific stated in there unless they could prove that there was gross negligence. We'll talk about that in a second. So then the other documents that would be examined in a negligence suit would be the standards of practice, policies and procedures that were in place at the facility that you were working in, and best practice. Like, so what are other athletic trainers in the industry doing? And by industry, I mean athletic training. So negligence could be negligent delivery of treatment. So omission occurs when an individual fails to respond to a given situation when a response is necessary to limit or reduce harms. Commission occurs when an individual acts on a situation but doesn't perform at a level that a reasonable and prudent person would perform. There's also negligent care of facilities. An injury sustained from improper or unsafe facilities can result in negligence being found against the staff or the institution. So for this reason, all therapeutic equipment must be inspected and calibrated by a qualified service technician at least yearly. The inspection or service date, the technician, and the services performed should be documented and kept on file. So that's definitely one thing about using anything like whirlpools or ultrasound or e-stim or laser, or any of these more sophisticated modalities, is that you're going to have to pay to have them inspected and calibrated on an annual basis. And as a CADIE program, that's one of the CADIE standards as well. So definitely everywhere you guys go for clinical education, including at your internship site, the modalities have to be inspected and calibrated, and a copy of that report has to be on file with us before you're allowed to go to that place for any sort of clinical education. All right, so on this diagram right here, it talks about these concepts of negligence. So in a situation where a patient, let's say we'll take a catastrophic situation. So let's say you have a basketball player who collapses on the court and dies of sudden cardiac death. When you go, if the patient's family was to sue you, the athletic trainer, and you are involved in this legal case, the first question asked is, did the defendant have the duty to care? So it says here, duty of due care. So in other words, was it your responsibility to take care of that patient? And by virtue of your job description, it was. Like, that was an athlete who was at the school that contracted you, so you were paid to take care of him, and he died of a heart attack on the court. Did the defendant breach their duty? So what was your duty there? To provide emergency cardiac care, activate the emergency action plan, and you did everything correctly. All right. Did the plaintiff suffer harm? Well, the harm in this case would be easy to prove. And then did the negligence actually cause the harm? So if it could be demonstrated that you did something wrong, did the harm actually cause the patient to suffer whatever harm was noted in the injury? So if all of those things, if the answer to all of those questions is yes, then negligence occurred. And if not, negligence did not occur. So if you had your AED, if the AED worked, if you had your emergency action plan in place and you activated EMS, you did CPR on the patient, you recognized right away what they were suffering and you treated it accordingly, all of these things, then the family cannot sue you for negligence. All right, so these are sometimes abbreviated as duty, breach, harm, and cause.